All right, let's get right into it. We're about to explore this absolutely massive shift happening in India's health insurance world. Seriously, it's a whole revolution, a move away from a model that was all about just pushing policies to something that's genuinely and finally putting people first.
So let me just start by asking you a quick question. Think about your own health insurance for a second. Is it, just sitting there waiting for something bad to happen? Or is it actually a part of your daily life actively helping you stay healthy? Because that question right there is at the heart of this entire transformation.
And here's what that change looks like, side by side. You had the old way, the policy push model. It was reactive, super confusing, and only cared about you when you were sick. Now compare that to the people first model that's taking over. It's proactive, it's simple, and it's all about keeping you well in the first place. So how on earth did we get from point A to point B?
Well, first, we got to take a look back. We need to understand the old model, a system that was basically built from the ground up to deal with sickness, not to actually promote health.
For decades, this was just the norm for pretty much everyone in India. You'd get a policy, probably just for the tax break, and it would be filled with all this confusing language and hidden rules. It was completely reactive. It did nothing for you until after you were already unwell. And oh man, if you actually had to file a claim, good luck. It was a notoriously painful, super slow process.
So really, it all boiled down to this one simple fact. The whole relationship with insurance was built on fear. It wasn't this cool tool to help you live a better life. Nope. It was a grudge purchase, a safety net that you just crossed your fingers and hoped you'd never, ever have to test.
And then, bam, everything changed. The COVID-19 pandemic hit, and it became this huge, unexpected wake-up call that literally forced the entire industry and the country to totally rethink what health and wellness even mean.
What unfolded was like a massive domino effect. First, suddenly everyone's health awareness just went through the roof. It became priority number one. That in turn led to this incredible surge in demand for health insurance. And with millions of new people flooding in, the old, clunky system it broke. It couldn't keep up. The industry was left with a choice: innovate or die.
And this right here was the big psychological flip. Health insurance went from being this boring financial product you bought to save a little tax to an absolute essential. For millions of families, it became completely non-negotiable. So right out of the ashes of that crisis, this brand new model started to take shape. This is the moment we go from reactive to proactive. And it's all being driven by technology and, frankly, a new obsession with making the customer happy. The engine behind all this change, it has a name: InsurTech. It's pretty simple. It's what you get when you smash insurance and technology together. We're talking about using AI, data, and mobile apps to make insurance way simpler, much smarter, and super personal.
And just look at what a modern health plan is actually made of today. The biggest chunks are things like telemedicine and online pharmacies, rewards for fitness and wellness, digital support, and traditional hospital care. Get this, it's now just a tiny 10% slice of the pie. It's a whole new world.
This all points to the new North Star: hyper-personalization. The idea of a one-size-fits-all policy is dead. The future, as this quote says, is about creating something that fits you perfectly: your diet, your lifestyle, your unique needs. I mean, this comparison just says it all, doesn't it? It's night and day. We're going from mountains of paperwork to one single app on your phone. From confusing legal jargon to simple, clear language. From waiting weeks for a claim to getting it processed instantly. And maybe the biggest change of all, we're going from only getting paid when you're sick to getting rewarded for staying well.
So what's the end game here? Where's all this headed? Well, the ultimate vision is way, way bigger than just insurance. It's about building a completely connected health ecosystem for the entire country.
And they've actually put a date on this incredible vision. There's a target that the entire industry is aiming for, and that target is the year 2047.
Why that year? Because that's the deadline for a huge national goal set by both the government and the industry: insurance for all. It is a massive commitment to make sure every single citizen in India has access to health protection.
So how do we get there? Well, think of it like this. Your insurance plan becomes the remote control for your health. It's the starting point, not the end. It connects you to your gym, your doctors, your pharmacy, your lab tests, all of it. And it uses data to give you smart, proactive advice to keep you healthy, making quality care something that's truly accessible for everyone. Now look, this revolution is building an incredible future, for sure. But it's a future where our insurer knows how many steps we take, what we eat, maybe even how well we sleep. And while that data can be used for good, it does leave us with one last, really important question to chew on. As our insurance company becomes our daily health partner, what is the new price of our privacy?